Hi everyone, I'm Ningbian. Today I will present Chapter 10, Guillain-Barré Syndrome. Table of Contents. Overview, etiology, diagnosis, manifestations, treatment, prognosis, contraindications, and the management plan. Overview. Guillain-Barré syndrome is an acquired inflammatory condition of the peripheral nerves. The exact cause of this syndrome is unknown, but it appears to be an immune-mediated condition, often following infection that appears to sensitize the immune system to antigens that the shield between the inflecting organism, the peripheral nervous. Etiology. Guillain-Barré syndrome is a post-infections immune-mediated neuropathy. That means, first post-infection, the condition typically develops after you've had some type of infection. In up to 70% of people who have had GBS, their symptoms start within 1 to 6 weeks of an illness. Second, immune mediated. An immune mediated condition results from an abnormal immune system response. For some people, after they get sick, their immune system responds abnormally and attracts and damages their peripheral nerves, leading to GBS. So neuropathy, the immune system attracts your nerves rapidly over days and causes less of myelin, thus the insulation of your nerves. Researchers have identified some infections and other immune system related factors that can trigger Guillain-Barré syndrome, including diarrhea res- or respiratory infection. About 2 in 3 people with GBS has diarrhea or a respiratory infection weeks before developing GBS symptoms. Infection with the bacteria Campylobacter jejuni, genuini, which causes diarrhea, is one of the most common triggers of GBS. Viral infections. Some people with GBS have had the flu or infections with cytomegalovirus, Epstein-Barr virus, Zika virus, or other viruses. Vaccines. In very rare cases, people have developed GBS in the days or weeks after getting certain vaccines. Surgery. Very rarely, GBS can develop after any surgery. Diagnosis. The symptoms of GBS can be similar to several other neurological problems. The signature signs of GBS are symptoms that appear on both sides of the body at the same time and start quickly. GBS usually appears within hours as opposite to other neurological problems, and the symptoms can last for months. There are 3 ways for diagnosis: physical examination, lumbar punctures, novel conduction study. Manifestations. The severity of GBS can range from very mild to severe, depending on the severity of the condition. Other symptoms may include deep muscular pain in your back or leg, paralysis of your legs, arms, and all facial muscles. In severe cases, you may experience near total paralysis, chest muscle weakness, which can make it difficult to breathe. This affects about 1 in 3 people with GBS. Difficult speaking and swallowing, difficult moving your eyes and vision issues. The first symptoms of Guillain-Barré syndrome are muscle weakness and or tingling sensations. Treatment. There's no known cure for Guillain-Barré syndrome, but some therapies can lessen to severity of the condition and shorten your recovery time. The main treatment for GBS are plasma exchange and intravenous immunoglobulin therapy. Both of these treatments usually shorten your recovery time if you start one of them within 2 weeks of developing GBS symptoms. Treatment for complication, they are respiratory care, blood clot prevention, IV fluids, and tube feeding. Prognosis. Recovery of GBS depends on the extent of myelin damage and whatever it includes damage to peripheral nerves. Some patients recover within 3 weeks. Many patients will recover within 6 to 12 months. Others can take up to 3 years to recover. Most people will recover from GBS, but it's still fatal in 4 to 7% of cases. It is estimated that 7 to 15% to 40% of people who have recovered from GBS will have residual problems. Typical residual problem including persistent weakness, slow reaction, out of balance, and sensory loss. Personal and psychosocial problem. Even after individual has achieved maximum recovery, financial worries, fear of permanent incapacity, and the loss of dependence may have long-lasting psychological effects. Activity and participation. The psychosocial impact of the acute phase of the condition combined with the long-term recovery process may make it difficult for some people to return to full activity levels. Vocational issues. Such interventions may include driving retraining, learning activity pacing, and in some cases, re-employment training. Initially, they may consider returning to work on a part-time basis and expect to need regular breaks during the day. For individuals who need to use a wheelchair for some time after discharge, construction barriers should be considered at their place of work. Country indications. Foods avoid processed and high sugar foods. Instead, choose fruits, vegetables, whole grain, and lean meats. Drugs avoid corticosteroids within GBS patients. Management plan. When patients begin to improve, the medical team may refer them to a rehabilitation facility. Here, they will work with physical therapy therapists and other therapists to regain strength and resume activity of daily living. Types of treatment include physical therapy, help improve the way the body moves and restore muscle strength. Occupation, occupation, occupa, occupational therapy helps improve the ability to perform daily tasks. Speech therapy helps restore spelling and speaking skills. Mobility aids. Equipment such as canes, braces, walkers, and wheelchair can improve mobility and reduce fatigue. This is my presentation. Thank you.